Okay, thank you, everybody. Welcome to our chief guest, Ajay Chhibber, who's, as you know now, head of the Independent Evaluation Office, and Dr. Rao from our co-host ASCI, and to all of you, many of whom we'll be hearing from later on today. It is indeed a great privilege for 3IE, together with ASCI, to be hosting this event, and we're very happy indeed that we do have a large number of very key speakers in the field of evidence-based policy here in India. And we hope that this event will be something of a scene setter in terms of the way in which the debate is headed here in India regarding the use of evidence for performance management. And so what I would like to do in this speech, in this introductory talk, is to make a few observations that I hope will help inform the discussions both that we have here today, but of course, as the debate in India goes forward, on putting in place a system of independent evaluations of government-supported programs at state level and centrally funded schemes, and thinking about, in particular, how it is you can use the findings from impact evaluations in your overall performance measurement system. And this is not a challenge that India alone faces. As we go around the world and talk to other governments and to other development agencies, we find that many of them have gone some way down the road already in conducting, commissioning impact evaluations, but they've actually given very little thought to, well, what do we do with this information? In particular, what do we do with this information in order to inform our overall assessment of agency performance, state performance, and governmental performance as a whole? And so I'm going to talk on three different issues to draw out three lessons about how it is that impact evaluations, in particular, can help inform the use of evidence and the monitoring system to better measure performance and improve performance. The first example is one that many of you may have heard me speak before, is a case study from Bangladesh, a program I evaluated while I was at the World Bank, working actually with Ajay as my director at that time. So this is a nutrition program following a not uncommon design which combined both supplementary feeding to infants under the age of 3 years with nutritional counselling. And the nutritional counselling was really the mainstay of this program, where women in the villages were trained by NGOs to be what were called community nutrition practitioners. So the community nutrition practitioner would weigh children on a regular basis. They're meant to be weighed once a month up to the age of 3 years. And children who were seen to be growth faltering or undernourished were entered into the program. And once entered the program, the mother received the supplementary feeding to give to them, and the mother received nutritional counselling from the CNP, the community nutrition practitioner. And the sort of things they would be told would be, for pregnant women, the importance of taking more rest during pregnancy, eating more during pregnancy, feeding the colostrum at birth, exclusive breastfeeding for 5 months. Once a child is weaned onto solids, to wash vegetables wash vegetables before you cut them rather than vice versa. Don't leave them soaking once cut for a long time. Mix up vegetables, have a different selection of vegetables each day, and so on. This sort of nutritional information being passed to mothers. Now, as you're all aware, there's been historically something of a puzzle about malnutrition in South Asia, in that malnutrition rates here in South Asia are much higher than you'd expect given general development levels. So you see malnutrition rates in many parts of South Asia, here in India, but also in Pakistan and in Bangladesh, which are much higher than you see actually in much of sub-Saharan Africa, where incomes are much lower, female education is lower, and so on. So you'd actually expect better malnutrition rates here, lower malnutrition, and that's not what you see. And the World Bank in particular was struggling with various things like school feeding and vitamin supplementation and so on to try and tackle malnutrition, and not really finding anything that worked. Then in the early 80s, it started supporting the Tamil Nadu Integrated Nutrition Program here in South India. And by the late 80s, early 90s, there had been dramatic reduction in malnutrition in Tamil Nadu, and it was generally felt that this Tamil Nadu Integrated Nutrition Project had been a substantial part of the story behind improved malnutrition in Tamil Nadu. So a similar design project, the Bangladesh Integrated Nutrition Project, BINIP, was to be tried in Bangladesh. And BINIP was a pilot program being carried out in 79 upsillas or tanas sub-districts across the country. A few years into the project, so it started in 1996, and so by the early 2000s, what the monitoring data was showing were dramatic reductions in malnutrition in program areas. So this program had very good data on what was happening to children in program areas, because what the program was doing was weighing children on a monthly basis by the community nutrition practitioner and collating those data across the program villages and program sub-districts. Project staff could clearly see this dramatic reduction in malnutrition across all program areas. And so, in response to that, when the World Bank president visited Bangladesh in the early 2000s, he was told, we've really sorted out and solved this problem of why malnutrition is so high in South Asia. It's actually the ignorance of mothers of these children of how best to use resources at their disposal. And by giving nutritional counselling to these mothers, we're actually managing to reduce malnutrition substantially. So in fact, severe malnutrition had fallen from 17% to just 3%. So severe malnutrition, more than 3 standard deviations away from the reference norm, had been virtually eliminated during the first 5 years of this program in program areas. And malnutrition, 2 standard deviations away, had also fallen substantially. So based on this evidence, the World Bank president said, this is great, let's go to scale. And the World Bank gave a new $1 billion credit to roll out a new national nutrition program based on this same model. This decision proved somewhat controversial, and in particular the UK-based NGO Save the Children came along and said, we don't really buy this story, we don't buy the story of ignorant mothers, we think the problem of malnutrition in Bangladesh, in rural areas, is one of poverty. Families are too poor to feed their children properly. And they conducted a simple, what we'd call ex-post single difference impact evaluation, where they went to some program areas, measured malnutrition rates, went to some neighbouring non-program areas, which they thought were similar, measured malnutrition rates there, and they compared the two, and what they found was actually there was no difference. There was no difference in malnutrition rates between the program areas and the non-program areas. So Save the Children said, this program's not working. The problem really actually is poverty, and you need to do something different. So as I said, I was at the World Bank at this time, and we were doing a study of maternal and child health in Bangladesh more generally, and as part of that we decided to focus on this particular BINIP program. Let's see if we can get rid of
your cell phone is in your pocket.
But it's turned off.
Yeah, apparently that's what is causing.
It's turned off, you can take it away.
Take it away.
No one ever calls me anyway, so it's fine. Okay, maybe it's yours. Do you think of that? Is this turned on? We found the suspect. There you go, the culprit. No? Also turned off. All right, we're looking at Ajay now. Okay, thank you. But it seems to have gone, thank you. We're off now, all right. Okay, so they found that there was no difference in malnutrition rates between program and non-program areas. The program wasn't working. And I was at the evaluation group at the World Bank, and we decided to look at this particular program. And we use a slightly more sophisticated evaluation design called propensity score matching. I won't go into the details of how we did the study, but basically at the end of that we also concluded the BINIP program was not working. So we found no difference in our matched comparison group of children in malnutrition rates in program areas compared to non-program areas. Now, this was very controversial, and in order to substantiate our arguments and our finding, we adopted what we call a theory-based approach of looking at the causal chain underlying the intervention to see if we could explain why it was this program seemed not to be successful. And I'm going to, for any program, even though it might seem very simple, you're telling mothers how to better feed their children, you're giving supplementary feeding to hungry, malnourished children, so it seems like, well, that ought to work, what's the problem? For any program, there's a series of assumptions, of things that might actually be incorrect assumptions or weak or missing links in the causal chain. And here you have separate causal chains for supplementary feeding and nutritional counselling. And I'm going to pick out just 4 of these assumptions where we think there were missing or weak links in the causal chain that explained why the BINIP program wasn't working. First of all, you need to identify the right group for nutritional counselling. So this group was targeting the mothers of young children. This project was targeting mothers of young children and telling them how better to feed their children. But the fact is that in Bangladesh, mothers are not the sole decision makers over how to feed their children. And that's for two reasons. One is that in rural Bangladesh, food comes into the house either because you grow it in your own land, and that's decisions made by the men of the family, or you buy it in the market. But in rural Bangladesh, women don't do the shopping. It's the men who do the shopping. So the man is the one going to the market and buying the food that's used in the household. So the woman's not actually got that much control over the food available to feed the child. Of course, you might argue the woman's still the one that actually prepares the food, so things like washing the vegetables before you cut them are still useful advice, but you'd be wrong. And why would you be wrong? Because many of these households are joint households, which means the woman lives for her mother-in-law. And what do mother-in-laws do the world over? They tell their daughter-in-laws what to do. That's their job, yes? And they like doing it. So if this woman is trying to wash the vegetables before cutting them, the mother-in-law can interfere and does interfere, say, what do you think you're doing? That's not the way we do it. And so this programme had failed to actually address the husbands of the mothers of the children and the mother-in-laws of the mothers of the children to actually realise they're key decision makers. And they need to be informed about this programme and told your wife, your daughter-in-law will be coming home with some ideas of how to better feed your child or grandchild so they grow up healthy and strong. Please listen to these ideas she's got and think about changing your practices accordingly. This programme wasn't reaching out to these groups. It wasn't using the imams and the Goma prayer to reach out to men in the village through what we sort of think are obvious channels to use when we're trying to change behaviour. So actually, this problem was so severe that women living with their mother-in-laws were in fact 30% less likely even to take their children to be weighed in the first place. Because mother-in-law is living there in the house with them, saying, where do you think you're going? You can't go out into a public area where men will look at you, and so on. So the failure to reach mother-in-laws was a missing link in the causal chain behind this programme. Second issue is that knowledge is acquired and used. This is a behaviour change programme. Most development programmes actually are trying to change someone's behaviour somewhere along the line. And what do we know about behaviour change from around the world? We know that generally giving information to people, don't smoke, take more exercise, eat fresh fruit and vegetables, don't have unprotected sex. These ways of changing behaviour generally don't work. Just telling people something's good for them doesn't change their behaviour. So, and where it does work, for example, in reducing smoking or drink driving in developed countries, it took decades, not months. And it was actually joined by a number of price signals and other things to change social attitudes over a long time. So trying to shift social attitudes in a short period of time is not very realistic. And what happened, we found in programme areas, knowledge did improve. So mothers of young children programme areas did know about cutting their vegetables after they've washed them and the colostrum and the breast milk and taking more rest and so on, but they didn't do it. So behaviour change communication achieved the communication but not the behaviour change. And why was that? Well, we had these results in the quantitative data, went back out to the field, did some focus groups, got women together and said, look, you know all this stuff, you're not doing it, what's your problem? And one group said very explicitly, well, sir, it's our mother-in-laws. When our mother-in-laws are passed, maybe we'll do these things you're telling us. But until then, it's not up to us. So the failure, again, to address other key decision makers was a very key weak link in the causal chain here that meant that knowledge was being acquired and not being used. You think changing behaviour from nutritional counselling didn't work. We didn't really buy this ignorant mother's idea anyway, but you're still giving supplementary feeding to malnourished children. What can possibly go wrong? Well, of course, you have to enrol the right children in the programme. And when we looked at the data, we had access to data from the data that Save the Children had collected, and we could tell from those data there was massive mistargeting of this programme. That many children who were in the programme weren't malnourished at all, whereas many children programmers who were malnourished weren't getting into the programme. Why was this happening? We looked at a variety of possible explanations, and the one we found was, we're targeting the programme through the monthly weighing at the weighing station by the community nutrition practitioner, and she's entering their weight on a growth chart, and we found that was all being done fine. The problem was that the CNPs did not know how to read the growth chart. We tested them. We went around and tested some CNPs, said which of these children, based on these growth charts, ought to come into the programme. They hadn't got a clue. So the CNPs were basing the children they entered into the programme based on what they saw, what they thought about the child or their family, what the mother told them, something, but not the correct criteria of growth faltering or malnourished. So there's massive mistargeting, which meant you were giving the programme to the wrong people. If you want to lift someone out of poverty, you have to give the programme to people who are poor in the first place. Yeah, so we give cash transfer to all you people. We're not listing anyone out of poverty because none of you are poor. Yes? So you've got to target to the right people, and this wasn't happening for a lot of the programme. They weren't giving the programme to children malnourished, so they weren't going to stop them being malnourished. And even in the cases where they were going to the right people, then of course the supplementary feeding has to be supplementary. But 22% of the mothers were actually using the food as a substitute, not a supplement. They were giving the food, to the supplement to the child in place of their regular meal. Now that might have been a failure of communication. They might not have learned properly what they're meant to do with it. Or it might be that they actually, just poverty meant they took the opportunity to substitute even though they understood they shouldn't be doing that. But the fact is, once you give a little packet of yellow goo made out of rice and sugar to a child rather than a regular meal, that's not going to improve their malnutrition. Their nutrition. It's actually may even worsen it because there were no micronutrients in these packages. So we managed to explain why this programme wasn't working. But the key thing is to go back to what I said near the beginning, that the monitoring data said this programme was working. But the fact was, when you looked at nationwide data from across the country, from the Helen Keller Surveillance Survey, from Demographic and Health Survey sources, you saw that actually malnutrition rates were falling across Bangladesh at this time. So the fact they were falling in programme areas was not inconsistent with the fact that we said there was no impact of the programme. Malnutrition rates were falling in programme areas, but they were falling just as much elsewhere. The changes observed in the programme areas were not because of the programme. So the key lesson number one, which I think is very important, is outcome monitoring really is important. There's very good work done in India, for example, by Pratham's annual review of education, which is very influential, which is monitoring data, which plays a role and matters. But outcome monitoring cannot tell you about results. It can't tell you what difference you made. It can't tell you if your programs are responsible for the changes you see in outcomes. Only impact evaluation can do that. So impact evaluation, studies designed to look at what difference government programs made and NGOs programs make, they're essential. For an overall results performance system has to be based on impact evaluations to look at the top end of the causal chain, what differences our programs make. A useful way of thinking about this and the causal chain is what I call the funnel of attrition. Now, the point of the funnel of attrition helps explain why programme impact is typically a lot less than we expect it's going to be. Suppose we target 100 people of our programme. We think we're going to reach 100 people with this particular programme. Well, actually, it turns out that the 100 we want to reach, probably only around 75 of them know about it, because dissemination is imperfect. We don't reach everyone we want to know. Take this event, we wanted to reach at state government levels, key officials in decision-making agencies. We didn't have contact details for all of those, even with ASCI's great networks. There's some people out there we wanted to reach, we probably didn't reach to actually know about the event in the first place. Of those that we want to take part, we say here of the 100, maybe only 45 take part. Okay? There are a lot of empty seats here because some people who said they're going to come, they didn't turn up. One didn't turn up yet. And they're lost, but they're not here. Okay? But some of them might actually have been invited. We identified them. They didn't want to come. They thought, no, that's not something interesting to us. And I think, and Joe mentioned this briefly when we talked about the need for formative research, we've funded lots of impact evaluations of things that it turned out people actually weren't interested in. There was no point doing an impact evaluation because we were looking at a programme that really didn't appeal to people for one reason or another. And then in most programmes, you need to have effective communication. If you want to change behaviour of people, they need to understand what it is they're expected to do. And what do we know from thousands of years of having formal education systems? There's something else that don't work very well. Most students don't, or very few students indeed, leave school having had 100% in all of their subjects, because knowledge transfer is imperfect. I remember when I first became a university lecturer many years ago now, and you get into the first batch of exams, you want to cry. Where were these people, you think? I explained this 3 times. Why aren't they getting it right? Yes, knowledge transfer is imperfect. And so it's not surprising the CNPs in Bangladesh didn't know how to read the growth charts. Pedagogical methods in Bangladesh suck big time. So you're put in a room, someone lectures you for an hour, now go out and do it. It's not a very effective means of transferring knowledge. And there was no way of checking up they were really doing this. Then you've got to communicate the knowledge. People have to then take on board that knowledge. There's a whole field in cognitive psychology about how just getting people to take on board knowledge is not sufficient to change their behaviour. So have to internalise this and agree with it and remember it the next morning and so on. So again, take this session. All of you have turned up, but for this conference to work in terms of our theory of change of why we're doing this conference, you have to pay attention to what I'm saying, not be busy on your mobile and your internet and so on. Okay? You have to actually understand what I'm saying, which can be a challenge sometimes, and our subsequent speakers, agree with what we're saying, internalise it, remember it tomorrow, and go out and do something different as a result. So if we have 120 people at this event, which we expect, how many of those will really go and do something different as a result? 3, 4, 10? It's not going to be the whole 120 that come. So the funnel of attrition moves down the causal chain, trying to identify problems that may arise. You're doing work in communities, if you don't have the buy-in of community leaders, you're going to face big problems. People aren't going to take part because of opposition from community leaders. You might be doing something that's the wrong time and place for people to take part and so on. Many problems that may arise. So monitoring at lower levels of the causal chain, below the outcome level, actually yields useful information about programme effectiveness. So when you're talking about incentives, and say in Singapore linking pay rates to GDP, I must admit, I'd feel that's a bit unfair. Because we all recognise there are multiple factors affecting GNP. So let's take water supply. If you want to take child diarrhoea, which is the relevant outcome variable for water supply, and use that to monitor, to reward people's performance in the sector, I would feel that's linking it a bit too far. If you can link it at people accessing clean water as a deliverable output that the minister in that sector is responsible for, that to me makes sense. But we need to have impact evaluations that show the final link from indeed clean water to achieving the outcomes we desire of reduced time collecting water and improved child diarrhoea and general health and so on. So I think if you've got a good causal chain, which you really believe in, but this does link to this and links to this, and you've got evidence to demonstrate those linkages, then you can actually get monitoring data from lower down the causal chain and use it for performance management because you know and you've documented those linkages are there. So this brings me really to my final point of harmonising evaluation with monitoring. It's not that there's no M&E in India. I mean, no one would think there's no M&E. There's lots of M&E in India. It's been going on for decades. But it's not used much by policymakers. It's done because it has to be done, but it's not done and used to inform decisions. And that's because a lot of it's not very good. It's not done in a way that answers the question they want answered, and it's not part of an overall integrated performance management system. So if I'm talking about having evaluation as part of that system, you do need to think about harmonising evaluation with monitoring. So the first is to try and get common indicators with a common methodology across your evaluation, your system, your monitoring system. You can't allow your impact evaluation teams to wander off and define their own indicators in their own way and measure those, because you can't then map them back into your monitoring system. And the example I will give is the Indian poverty debate. So as most of you probably know, how much poverty fell in the second half of the 90s was a very political issue because of the reforms at the beginning of the decade. And from 93 to 99, government claimed a 10% fall in poverty. But academics looking at the data were critical because of the change in the recall period in the survey conducted by NSS. And academic estimates were the actual fall in poverty was only 7% rather than 10% if you define the recall period in a comparable way between the survey rounds. It sounds like a very technical issue, how you define the recall period of particular consumption items in a particular survey, but it really matters. These are big difference. A 7% fall or a 10% fall means millions of people in a country like India. So getting your indicators defined in a common way matters. Second is use evaluation data to validate, or what's called sometimes here ground truth, the monitoring data. And the example I've got here is other work I did in AP, again when I was at the World Bank. I'm looking at self-help groups. So of course, SHGs, AP was the state where these really flourished and took off in the late 1990s, particularly early 2000s, dramatic growth in SHGs. We did a survey in 2005, and at the time we were doing our survey, the World Bank office was telling us 90% of women in rural areas in rural AP are members of self-help groups. We went out and did a survey, and the figure we found was 50%. So we found that our number was far less than that being shown in the monitoring data. Now again, we've got discrepancy. Your discrepancy, be convincing that I'm right and you're wrong, is much more convincing if you don't just say I'm right and you're wrong. You actually can explain why I'm right and you're wrong. And this was quite easy to do in this case. So when we're doing the survey, when you go to the village, the first thing you do is have a village meeting with the sarpanch and the village secretary and other village notables, and you sit around, you introduce yourselves. And when the discussion would come on to SHGs, you'd typically get a comment like this. They would say, oh yes, SHGs. There are 20 in our village, of which 13 are functioning. SHGs stopped functioning. They closed down. They dissolved. But the monitoring data only collected group formation. It never collected data on groups dissolving and stop functioning. So the data they had was a stock of all women who had ever been in SHG that ever existed ever. It didn't include all those ones that stopped working. So we had a correct statement. 50% of women are currently in an SHG that is functioning. 90% of women have at some time been in SHG. May well be true, but it's a far less interesting figure. But that's what the monitoring data are actually telling us. So you can use evaluation data to actually check the validity of what your monitoring data are telling you. Finally, and these are 2 points I've already made, use monitoring indicators along the causal chain. They can help inform evaluation. Monitoring isn't simple just counting numbers of meetings held, number of people attending meetings. You can get better quality, more meaningful monitoring data. For example, on if you've got extension workers, do they actually know what it is they're meant to be communicating to farmers? So you can actually, during even monitoring, you can test the quality of knowledge being put out by extension workers. And this is done too little. But if you can do that, it gives you very valuable data at the monitoring stage that you can already feed back into performance management. You don't have to wait for an impact evaluation to use the data to make changes in program design. And finally, as I've already said, recognise where M can't go, where monitoring can't go. It can't tell you what the counterfactual is. It can't tell you what difference the program made. So my final slide is what I call the AAA principles for an overall monitoring system for measuring agency performance or statewide performance or government-wide performance. So the first day is alignment. So make sure that your indicators correspond to your high-level objectives. So when you're collecting indicators from an evaluation or from a monitoring system, they have to align to what it is you think you're trying to achieve. You've got a national plan, you've got a state plan, you've got a sector plan, you've got some objectives there. You have to make sure the data you collect actually give you information on those objectives. Sounds obvious. You'll see many cases, particularly impact evaluation designed, that don't actually collect indicators relating to overall objectives. So alignment, and alignment across all of your different studies you're doing. Secondly, attribution. So you want to make statements of a causal nature that your programs are making a difference. So you do need, as I've argued earlier, to include impact evaluation as part of your overall M&E framework. You need monitoring, you need process evaluations, you need formative evaluations, you need impact evaluation. I'm not arguing impact evaluation is all you need, it's not. You need a broad range of tools, but one of them is certainly impact evaluation. And finally, aggregation. This is the challenge. You need to be able to add up across programs. You need to have done several different studies, but to add them up to make some overall statement of agency performance. Now people say, oh, well, that's not possible. You've got a water supply program, you've got a roads program, you've got a women's empowerment program, and people say you can't add apples and oranges. Now that statement, just think about it for a moment, that statement doesn't make any sense. when you go to your grocer in the morning and you buy some apples and oranges, you don't go to him and say, I've got a real problem here. I want to buy some apples, but I want to buy some oranges too. And I can't add apples and oranges. Well, you can. You just say, well, that costs this many rupees, and that costs this many rupees, and we'll add them up, and we've got a total. So we have done project analysis for many years by adding apples and oranges by putting a monetary value on them. And that's one way in which, using cost-benefit analysis, we can actually make some aggregate measure. That's quite difficult for a number of programs. So there are other ways of doing this. The simplest one, which the World Bank uses in IEG and across the bank as a whole, is simply to rate programs as satisfactory or unsatisfactory in terms of if they've achieved the objectives or not. And then you can make a statement, 75% of our programs are achieving the majority of the objectives. You're adding up, you're adding apples and oranges. It's quite a crude way of doing it, but you are making a performance statement. So you have to think of some systematic and clear way to aggregate across your programs. So the conclusion from that is impact evaluation can and should be embedded in the overall M&E framework to be an essential part of results management. That's what today is about, and I hope we'll hear from the other speakers much more about how that's going to be done here in India. Thank you.